Thank you for joining me in our Strategies of Success WebEx series today. This WebEx is entitled ICD-10, Are You Ready? A step-by-step guide for your practice. My name is Carolyn Parker, and I'll be presenting the information on this topic today. Should you have any questions during the presentation, please feel free to submit them as you participate, and I'll answer them at the end of this presentation. On this call today, also, we have Kim Gray, who's a sales executive for Aviacode, and she's going to talk about a solution for ICD-10 at the very end of the presentation. On October 1st, 2014, the ICD-9 code sets used to report medical diagnoses and inpatient procedures will be replaced by ICD-10 code sets. The transition to ICD-10 is required for everyone covered by the Health Insurance Portability Accountability Act. Had a lot of practices asking for ways to transition into ICD-10, so I thought I'd offer some information within a webcast to hopefully answer everyone's questions. Also, over the course of the next couple months, I'll be contacting your practices and talking to your business office managers to find out what practice management system you're utilizing, and I'll do my own research to make sure if those particular practice management systems will indeed be ready for you. The information provided in this training module is not intended to be legal or medical advice. It is recommended that participants not rely on this general guide in structuring or analyzing individual transactions, but that professional advice be sought in connection with any such transaction. Nothing herein is the official position of Allegiant Creighton Health. It's no surprise that many healthcare organizations have not yet begun planning for the highly anticipated ICD-10 transition. Many believe that the Centers for Medicare and Medicaid, otherwise known as CMS, will postpone the October 1st, 2014 deadline, allowing for some wiggle room in implementation. Unfortunately, the likelihood of that happening is slim to none. To date, CMS has no plans of delaying the implementation of ICD-10, and for many healthcare organizations around the country, that means trying to locate the nearest panic button. So who does this affect? Well, the change is going to actually affect everyone who bills medical claims. Whether it's government or commercial payers, this will affect you. If you do not have the transition and you don't have ICD-10 available in your practice management system, your claims will not get paid. Your practice management system must be able to accommodate both ICD-9 and ICD-10 codes until all of your ICD-9 claims have been processed and completed. And despite the numerous articles and constant buzz surrounding ICD-10, many still believe the transition from ICD-9 to ICD-10 is as easy as flipping a switch. This is completely wrong. Many of the stragglers will soon realize that moving from ICD-9 to ICD-10 is not a simple one-to-one mapping strategy. In fact, many of the codes require multiple general equivalence mappings, or called GEMs, and greater specificity in documentation. Poor mapping and documentation will lead to denials by payers, and given that average cost of reworking a denied claim is $25, filing claims incorrectly can become very, very expensive very quickly. This cost alone is enough to send many healthcare providers into early retirement. Greater specificity and detail in all diagnosis codes, 34,250, whether 50% of all ICD-10 codes are related to the musculoskeletal system. About a quarter of them are related to the fractures. It's funny because 62% of the fracture codes distinguish whether it's right versus left. 36% of all ICD-10 codes distinguish right versus left overall. So that's why there's so many diagnosis codes that we're going to have to deal with. And the rest of the world pretty much has gotten on board with this. We're kind of late to implement this in the United States. So with this grid, this is basically how ICD-10 will affect you. So I'm going to be going over each of these sections, whether it's the physicians, nurses, lab, billing, coding, front desk, and we're going to talk about this in each area. So the first step within the managers. Any policy or procedure associated with a diagnosis code, disease management, tracking, or PQRI must be revised. So new policies or procedures are going to have to be put in place. Your vendor payer contracts. All contracts must be evaluated and updated. You're going to have to look at your budget. Changes to software, training, new contracts, and new paperwork will have to be paid for. And then a training plan. Everyone in the practice will need training on the changes. So managers, you kind of have your work cut out for you. You're going to be juggling and wearing even more hats than you were before. And for your doctors, the need for specificity dramatically increases by requiring laterally stages of healing, weeks in pregnancy, episodes of care, and so much more. Depending upon your specialty, everybody will be affected by this. The codes will increase from 17,000 to 140,000. Your doctors must be trained on this. Now, with the physician documentation challenges that they're going to face, the lack of understanding of what's required for specificity of documentation, the need to ensure detailed documentation is present in the medical record, you see a significant increase in the number of coding queries coming their way for further clarification and or specificity of diagnosis documented in the medical record. And it's interesting because right now we've had a lot of insurance carriers coming back with pre-authorizations, and they're asking for a lot more information. Insurance companies are trying to get ready too. So as you're trying to get everything and get your physicians trained on documenting things more clearly and better than just, they're trying to rush through all the patients, insurance companies need that as well as they're getting ready for ICD-10. They're now going to need to be a part of the team as they will drive the coding process. Physicians ultimately are responsible for the coding. You may have coders in your office, your billing department that's handling all this, but the codes are from the physicians. So they're going to really need a lot of support because ultimately it's their degree, it's their responsibility to actually do the coding. Physicians will now be affected in their own offices, and they're going to have to change how they document, like with your super bill, lab requisitions, etc. Here's the top 10 documentation tips. I'm going to go ahead and leave this up. You guys can come back and take a look at these. But these are the things that they're really going to be taking a look at that are going to really need to take a look at the specificity. That's the biggest part within ICD-10. So you can come back and take a look at this later after this presentation's over. I'll have this available for you. This presentation, both the PDF format will be on the MSO website, and this presentation will be available on YouTube following this recording. As far as nurses go, with their forms, every order must be revised or recreated. Their documentation must use increased specificity as well, just like the physicians. Prior authorizations, your policies might change in training and updates. So nurses are going to need help in this area as well. It's going to be a big change for everybody. The lab, again, needs to use increased specificity. Reporting, the healthcare plans will have new requirements for the ordering or reporting of services. In your front desk, and people might not think about this, but HIPAA, your privacy policies must be revised and need to have new forms signed. And your systems updated are likely required and may impact patient encounters. Now, of course, we all knew it was going to affect the billing department. All the payer reimbursement policies may be revised, and the billing department must be trained on the new policies and procedures in the ICD-10 code sets. Here's some new features to the new ICD-10. Combination codes for conditions and common symptoms. There's also combination codes for poisoning and external causes. The added laterality of left versus right. There's an added 7th character extensions for episode of care. Expanded codes, rose injuries, diabetes, alcohol, substance abuse, postoperative complications. Injuries are also going to be grouped by anatomical site rather than type of injury. Diseases of the sense organs, which are your eyes and ears, they actually have their own chapters. They're no longer a part of the service system chapter. The inclusion of trimesters and obstetric codes and elimination of 5th digits for episode of care. Change in time frames specified in certain codes. Full code titles for all codes. There's no reference check to common 4th and 5th digits. Post-op complications have been moved to procedure-specific body system chapters. So within the ICD-10 injury and external cause extensions, coders are going to need to look for the episode of care. So things like, is this the patient's first visit of the treatment, or is this a routine follow-up? And this is basically how they come up with the format. So you have the category, basically the anatomic site or severity, and the extension. Now within this, you're going to have a code set. Like I said before, the codes are going to increase from 17,000 to 140,000. The code styles and books are going to completely change. And I would imagine most of you are probably not going to get a physical book, but electronic books, considering it's gotten that much bigger. Clinical knowledge, which means more detailed knowledge of anatomy and medical terminology, it will be required with increased specificity and more codes. Concurrent use, the coders might need to use ICD-9 and ICD-10 concurrently for a period of time until all of your claims are resolved. So on here, here's basically the breakdown of the difference between ICD-9 and ICD-10. So you have your 3 to 5 digits or characters within ICD-9, and that's just a little bit more for ICD-10. The first character is numeric or alpha, E or V codes. Within ICD-10, the first character is alphabetical. All letters are used except for U. In ICD-9, the second to fifth characters are numeric. And in ICD-10, the second to seventh characters can either be alpha or numeric. In ICD-9, the decimal placed after the first 3 characters. But in ICD-10, that's actually the only one that's the same on here. And in ICD-9, the 17 chapters and V and E codes are supplemental, whereas in ICD-10, 21 chapters and V and E codes are not supplemental. So there's a very big difference, as you can see. It can be very cumbersome within ICD-9 and ICD-10. You can also see here that you're going from basically 3,000 procedure codes to about 71,000. So that's a really big difference. ICD-10 characters and values, and I'm having this basically, I want to explain the basics behind and the premise, kind of a nuts and bolts of ICD-10. That's why we're going to go through all of this before we get to some sort of solution for your office. In ICD-10, the character is a stable, standardized code component. It does hold the fixed place in the code, and it retains its meaning across a range of codes. A value is an individual unit defined for each character, like the section or the body system, body part, approach, device, qualifier, etc. ICD-10 picked characters, the medical surgical section, this basically lays out what these are for you there. Now with coding queries, one thing you're going to have to look for is you're going to want to expect a significant increase in the number of queries that will be generated from ICD-10. The existing coding queries will most likely have to be updated, as you're going to be asked for different documentation to capture specificity. Make sure that they're not leading the physician to document one way or the other. Consider making the query part of a permanent medical record, a physician addendum. And then track and trend for patterns, then do more education. So what's going to have an impact on your MS-DRG payments? Well, the lack of specificity for certain diagnosis is documented in the record. It could have the potential of not capturing the CC/MCC, which will result in a lower paying MS-DRG. Well, it could, most likely it will. MS-DRG shifts could occur due to the improper training of the coding staff. For example, if the coder selects an improper root operation for a code, like an excision for a resection, this incorrect code assignment could also potentially cause changes within the MS-DRGs, resulting in payment increases or decreases. So more than ever before, you're going to have to make sure that your physicians are getting paid for exactly the work that they did. So you're going to have to work as a team between the physicians and the billing department to make sure that exactly what happened for the patient is documented. In the clinical area, patient coverage, health plan policies, the plan payment limitations, and new ABN forms are going to have to be created. In super bills, revisions required in paper super bills might be basically virtually impossible. I mean, right now, within most super bills, you're wanting to put your top codes that you use. Well, considering you're increasing your diagnosis codes, your most common diagnosis codes will also go up as well. So unless you have some other kind of format, like an EMR might be very, very helpful, it's going to be very difficult. Billing's going to take a lot more time and effort at the beginning as well to get used to it. The ABN forms must be reformatted, and the patients are also going to require education. Patients are becoming more and more savvy about what their billing is, and they're going to have questions as to how specific everything's going to be documented within their records. So what do you think ICD-10 will cost you? Well, here's some estimated cost figures that I've come up for you. CMS estimates costs to the private sector for implementation for ICD-10 will exceed $130 million. There's a Hay Group white paper in 2006. The estimated costs for hospitals range from $35,000 to $150,000 for greater than 100 beds to $500,000, less than 100 beds, $500,000 to $1 million for 400 plus beds. The AAPC indicates the current documentation could be 50% coded, and the AHIMA indicates that after ICD-10, coders will be 50% slower for up to 3 months, and 50% more physician queries will take place. That's something I can definitely believe in. Potential hidden costs you might encounter in your practice: a backlog of uncoded claims with ICD-9 while trying to get coders ready for ICD-10. Remote outsourced coding might be needed to occur as well as OT. Rejected claims from payers who are not ready to accept the UB04 with ICD-10 plus ICD-9 as necessary. That's going to be a big thing. You're really going to have to see which of your payers are going to be up to date with this. And I mentioned this in my last WebEx, and as of January 1st, 2014, your payers, all of them, are going to be required to accept electronic claims. So not only are your insurance payers are having to make sure that they can accept all of your electronic claims by law, now they're going to have to deal with, 10 months later, making sure that they can accept both ICD-9 and ICD-10. Might be a good idea for your practice management system to partner with some of your insurance companies to make sure that they're going to in fact be ready. Vendor software rejecting ICD-10 or edits not working correctly, thus slowing claim submission. Manual intervention to ensure claims are submitted and accepted. That's another reason why I'm actually calling your billing office staff to see what type of practice management software you have. This is probably going to take me a few months to do. I'll be doing a follow-up WebEx talking about that and trying to figure out a way that we can partner with the insurance companies and partner with your vendors and see who's actually going to be ready and kind of expose it a little bit so that you know what you're getting yourself into in the coming year. New software, if existing software not related to ICD-10 work is not compatible, could be a hidden cost. If you happen to have a practice management system that just really isn't going to be ready for this, you might have to switch over to a different one. And even more hidden costs. Well, there's a cost to conduct a risk assessment to assess current documentation patterns in providers and caregivers. You can actually do this within your office. There's also a way that you could do this within Health Endeavors, so if you have questions about that, let me know. Potential salary adjustments for the coders. They're going to be doing more work, so of course they're going to be wanting more reimbursement for that in their salary. Costs to conduct training for providers and caregivers on enhanced documentation. There's going to be potential new costs to review EMR or other software to adapt to enhanced documentation requirements. Costs to conduct a readiness assessment, pre-go live and determine readiness of coders, documentation, and vendors. And the cost of moving related work from the coders during the training period, like drug administration and charge capture. And I hate to tell you this, but there's even more. Could be a loss of productivity, rebilling, denials, rejections, EOB work, medical necessity rejections, so forth and so on. Loss of productivity, excessive physician queries, coder slowdown with new coding process. Growth in the discharge not final build. Potential impact to the case mix index. Cost of a project manager, like a one-year contract staff to coordinate all the IT testing, training, and documentation assessments. Cost of implementing a clinical documentation improvement program. Cost of any EMR changes and training of all impacted staff. And finally, cost of any changes to the functionality of any new software and training costs. So the cost of everything and compliance and making sure that you're ready, well, that's something that I want to be focusing on with all of my practices that I'm working with till the end of the year. And actually, I'm going to be doing a lunch and learn in November, and we're going to be talking about compliance and trying to make sense of everything and get things prepared and ready, and maybe, you know, figure out a way that we can work together so that everybody can be one step ahead and maybe feel a little more comfortable with all these changes. So enough of the negativity and all the costs and everything else. I'm going to talk about when should we begin and what do we need to do. Well, the time is now. If you haven't already started, you're going to want to plan weekly, monthly, and even yearly implementation goals. You need to assess the impact on your organization, your systems, your processes, your staff, and productivity. And you can start your ICD-10 training by assessing your coders' preparedness. You can test coding staff on basic anatomy and physiology, which we actually have those available within the MSO website. Quizzes that identify the areas you need further training might be needed, and I actually have a link for that also on the WebEx, on the MSO website directly from the World Health Organization, and it is free. You want to start early and conduct early ongoing assessments so that all of your coders will be ready. And in case you haven't thought about it, you might want to develop an ICD-10 implementation team. This should actually start being developed pretty much right now. It's mid-2013, getting to the end. They should include the key leaders in the revenue cycle, IT, and health information management. You need to create a master list of all revenue cycle areas, IT, health information management, and physician issues. And identify timelines for when components will be done, who does it, results reviewed, testing with ownership, and timelines for completion. The key benchmarks of completion done beginning the first quarter of 2014 or once final go-live date is established. And after you go live, complete a second set of benchmark assessments with barriers, delays, more education, etc. Now, steps of implementation, we're going to talk a little bit about communication. You need to make a master list of all software where ICD-9 is being used. This will be essential to the seamless implementation of ICD-10. Maybe it'll just give you a little less, heartburn over it. Contact each vendor now. Identify with their rollout plan for compliance and when they'll be ready to test. Some of the billing managers I've already been talking to said, oh, I'm just going to let my, they're in charge of that. They have to take care of that for me. Well, I realize that they, tell you that they're going to take care of it, but if it were me and I were sitting in your shoes, I would actually find out from them a timeline. When are they going to be testing? When is your practice management system going to be testing with your clearinghouse? When are they going to be testing with the insurance carriers? Which of your insurance carriers are actually going to be ready? You want to test with each vendor early or late. It said in 2012 as soon as they're able for testing. They should have already been doing this. If you're not aware, you might want to give them a call. You want to make sure you keep your senior leadership well aware of the status before making any software and compliance changes, and make sure you're prepared to make changes if compliance is not achieved with testing 9 months prior to go live. That basically gives us until the end of January to make sure that you have some testing completed within your office. And of course, audits. Within your audits, you want to start now conducting ICD-10 documentation audits this year. You can do risk assessments of current documentation practices. You want to make sure and look in your physician's documentation, are they being as specific as they can be? And I actually have WebExes on this particular topic of documentation. There's several of them. If there's other information you want me to dive a little bit further deeper into, I'll be happy to do that for you. You want to audit your top 25 ICD-9 principal codes and map those to your top ICD-10 codes and begin auditing to determine whether or not the records contain the necessary clinical information to support the ICD-10 principal diagnosis codes. That's the easiest way that you can do this. So if you have your billing staff, whoever does your coding, pull out your top 25 principal diagnosis codes you're using now, and you match those up with your top, ICD-10 codes that they go to. You want to look at both the coding on that side and then the physician's documentation to see if you're getting all of levels specificity to document properly with ICD-10. Now, with coding audits, you want to target certain inpatient cases for review based on the MS-DRG assignment or the CCs, because both of these components will undergo changes when reconfigured with the ICD-10 codes. So if you have any physicians admitting into the hospital, you also need to pay attention to these as well. So what's going to happen when this all rolls over in 2014? To me, this kind of feels like when they had the Y2K thing, but it's a little bit different to me because this is coding. This, again, they said Y2K would affect your revenue stream. Well, not so much. This definitely will, because this is how you're documenting the work that's being done. So you could expect a possible decrease in cash flow due to increased time in coding medical records, the learning curve, potential increase in errors, decreased coder productivity when or will it recover, system vendor or software issues, potential reimbursement impact due to payer systems, claim edits, or processing issues. Could expect denials and underpayments, lower DRGs or IP lack of severity of illness due to non-specific documentation and unspecified diagnosis code. So what's your defense? What are you going to do to get ready? Really is never too late to start. It'd be nice if everybody started right now, and I'm going to be, again, meeting with all the practices within the next couple of months to try to help you guys get ready. You want to provide an adequate system and coding resources for Go Live. You need to figure out, are you going to need additional coding support? Are you going to need contracted coders? Who's going to be able to handle the coding of prior to accounts versus Go Live accounts? You might want to decide, you're going to have to do these at the same time. Do you have anybody savvy enough, or you want to split it up in your business office and have someone, be dedicated team member to ICD-9 till it's done, and then have other people work on ICD-10? Typically, even, when you change practice management systems, I always like to have one person dedicated to the old aging and to the old practice management system software, and start brand new and fresh with the new practice management system software. So if it were me sitting in your shoes, I'd attack ICD-10 the same way. As far as post-Go Live auditing and monitoring of coding documentation, increased coding queries, systems data reports, and your claims payments and denials. Basically, you want to get to the point where you're auditing and then doing more auditing from a risk to a readiness environment. There is actually free ICD-10 training on, like I said before, the Prairie Health MSO website. What's nice is if you go to the Resource Center and then you click on the World Health Organization ICD-10 training, it has a direct link to their website. It's a really nice website because you're able to, it doesn't matter how, your coder, how much education they've had, how long they've been doing it, what different type of, specialty that you are. It asks you all those questions ahead of time, and it gets you ready. I really very much, out of all the sites that I've seen, I like it, and I like it also because it's free. That's also nice. Now let's say that you're a group and you're seeing all this information, and maybe right now you're sitting there thinking, oh my gosh, how am I going to get ready in time? Well, I've actually partnered with a company called Aviacode to offer a solution for the ICD-10 conversion. They actually have certified coders in all specialties. They deliver coding results directly to your billing system. They offer guaranteed accuracy. Now you can contact me directly for this, or I actually have them on this particular WebEx with us as well, Kim Gray, and I'll have her information on here for you as well. They have a technology-enabled coding and auditing system. It's a vision web-based technology to manage all the complexities of medical coding process. Since then, 16 million records have been coded. Currently, there's 3 million annually. Their actual turnaround time is actually less than 32 hours, and their actual quality right now is over 97%. They have growth in each segment within these, so you can talk to Kim more about these and they can tell you exactly what solution might be better for you based on the size of your office and what your needs are. A clinical documentation improvement process and coder feedback gets generated into your reports. So it's not just a thing where you're turning over things to them and then they process them. They will work with you in trying to help you improve the processes and systems within your office. So your Aviacode Contact, again, is Kim Gray. She's a sales executive. I'm going to actually let her talk right now for a little while about what Aviacode does. And if you guys have any questions for her, feel free to ask them and we can answer those questions at this time. Okay, well, if you feel that there's some staff members that think would benefit from this presentation, if you want to make sure that your doctors are ready, your billing office knows exactly what's going to be coming, things that they can get ready for. This WebEx was designed for pretty much everybody in your office. So if you want basically an overview for your office, feel free to log on to the Resource Center and the SOS web series, and then click on, actually I have a ton of them in there, but you'll click on the one for today. And they'll be able to help you. I'm also having this up on YouTube, so you can feel free to go on YouTube. I'll send out a link to, if you want to have it on there, a link to that directly. I'll be doing a follow-up email today as well so that you can have that at the same time. Thank you so much for participating today, and I hope you have a wonderful rest of your day. Thanks.